as you also know, emergency committee is not like a parliament. So if they're divided, they don't go into votes, but they actually propose to collect more information and more evidence, and then come back and see if they can reach a consensus. And a committee that advises science and evidence-based organization should make sure that the right information and evidence is collected to reach a consensus on the recommendations they make to WHO or to me as DG. So that's why during their meetings on January 22 and 23, since they were divided because of lack of information, they had proposed to me to meet again after a few days to collect information, and they didn't recommend global emergency on January 23. Then after a few days, they got information and evidence, and they came back. I reconvened again on January 30, and they were then very confident because of the information they collected. And when they decided the global emergency on January 30, they had a consensus to recommend that to me. And this was based on science and evidence. And during that time, on January 30th, the number of cases we had outside China were only 82 cases, and there was no death. So, meaning, I repeat again, the world had enough time to intervene. And I can say it again, me and my colleagues believe that, and the emergency committee, this public health emergency, the global emergency on January 30, was actually declared in a timely fashion that allows enough time for the rest of the world to respond, because we only had 82 cases and no deaths. I repeat, 82 cases and no deaths. To declare global emergency in that situation, I think it says it all. It says it all. And anything between 22 and 30th January was to collect information. And then the other thing I would like to say is, even between 22 January or 23 January and 30th January, we didn't waste any time. We didn't want to waste any time. And as Mike said, we had to move immediately, travel to Beijing immediately to discuss with the leadership and to see for ourselves the situation in China. I remember then people telling us, advising us not to travel to China because this virus is new, you don't know how it behaves, you're putting your life at risk. And we said, no, we go, because there are people who are putting themselves at risk in China and elsewhere, so our life is not different from them. We're actually the responsible guys to fight the virus and other outbreaks. So we should put ourselves first, actually, and we will go. The virus is unknown, but we're not afraid of the virus.